Hi, and thank you for joining Telecare's Consultant Corner, a short video on general health inquiries submitted by local Australian GPs, answered by our Telecare physicians.
Hi, my name is Vivien and I'm a neurologist. Today I'll be presenting 3 tips for assessing and managing headache, which is one of the commonest referrals to a neurologist. Firstly, consider secondary causes of headache. Although primary headaches such as migraine and tension-type headache are common, it is vital not to miss secondary causes. 2 important conditions to bear in mind are idiopathic intracranial hypertension and giant cell arteritis. The typical demographic for IIH are females of childbearing age who are overweight or obese. Specific symptoms to ask about are transient visual obscurations and pulsatile tinnitus. Importantly, it can occur in people with another form of headache, such as migraine, so IIH should still be considered if there is a change in or worsening of existing symptoms. Fundoscopy to assess for papilledema is crucial to diagnosis, and patients may be referred to an optometrist to do this. GCA should be considered in people over the age of 50, particularly if they experience scalp tenderness, jaw claudication, visual disturbance, or constitutional symptoms. ESR and CRP are elevated in most patients, but can still be normal in 5 to 10%. If the level of suspicion is high for this diagnosis, high-dose steroids should be commenced empirically whilst arranging for a temporal artery biopsy. The second tip is to avoid excessive use of acute analgesics. Overuse of acute analgesics is common in people with chronic headache, but can in fact exacerbate symptoms in the longer term. Acute analgesics include opioids, codeine, and triptans, which should ideally be used no more than 10 days a month, and non-steroidal anti-inflammatories, which should be limited to no more than 15 days a month. In order to reduce reliance on acute analgesics, patients may require commencement of a migraine prophylactic agent. The third tip is to think about sleep. People with chronic headache often experience poor sleep, and conversely, sleep disorders can also exacerbate headache. Encourage good sleep hygiene and lifestyle habits. Medications such as amitriptyline, which have a sedating effect, can be helpful in patients requiring migraine prophylaxis and who have poor sleep. However, remember to start low, particularly in the elderly, and warn patients to be aware of oversedation. It is also important to inquire about sleep disorders such as obstructive sleep apnea, as this can exacerbate headache and it is treatable.
Thank you for watching. If you would like to submit a question to Telecare's Consultant Corner, please feel free to email us at admin@telecareonline.com.au. Telecare, putting the care into telehealth.